Treatment techniques. Selecting the proper treatment technique is imperative to providing good treatment outcomes for your patients. There are two treatment techniques, point technique and flattening technique. Both treatment techniques provide the best outcomes and safety when treating patients with the plasma device. Each technique is ideal for treating certain types of skin conditions, and will be reviewed in this section. No matter which technique is being used, the following guidance regarding dwell time on the skin should be adhered to. To avoid pitting or scarring the skin, hold the device probe in one spot only until you see the plasma energy arc to the surface of the skin, as seen in this video. The skin will also tend up toward the probe. As soon as this happens, move the device probe to the next treatment spot. The amount of time required for this to happen is a fraction of a second. The first technique is the point technique. It is the best treatment technique for loose skin. It can be used on most areas of the face where a patient has loose skin, such as upper and lower eyelids, sides of the face, and the neck. The point technique is a series of rows placed on the area of the face with loose skin. It is important to follow the pattern and leave a sufficient amount of space between each point so that the skin can contract into a central point. Optimal placement of the rows is in an offset pattern, as shown in this graphic. There will be approximately 1 to 2 mm between the placement of points. It is recommended to place 2 rows in parallel, allowing enough space for an additional row to be placed between those 2 rows in an offset pattern, as shown in the graphic. This video demonstrates the point technique. The second technique is the flattening technique. It is the best technique to use for fine lines, wrinkles and folds, such as nasolabial folds, crow's feet, and lines around the mouth. The flattening technique is a series of points that are placed on both sides of the line, wrinkle, or fold, and are spaced approximately 1 to 2 mm apart. The point should follow the entire length of the line, wrinkle, or fold. The number of rows needed to optimize results depends on the severity of the wrinkle or fold. For fine lines, 1 to 2 rows of points on each side of the line should be sufficient. For moderate wrinkles and folds, 1 to 2 rows of points on each side of the wrinkle followed by several rows of dicing technique is recommended. This video demonstrates the flattening technique. Now we will review recommendations for treating specific areas of the face. Let's start with loose skin of the upper and lower eyelids. When treating the loose skin of the upper and lower eyelids, patients may need 2 to 3 treatment sessions to achieve desired results. Contraction or shrinkage of the skin will be seen on the first session, however, this initial shrinking is a result of dehydration caused by sublimation. Long-lasting results occur once the crusts slough off and the treated area progresses through the 3 phases of the healing process. When treating the upper or lower eyelids, use the point technique and start at the medial corner of the eye and work laterally. Avoid the inner eye area as it is very sensitive and will cause unnecessary edema. Additionally, stay at least 2 mm from the lash line. To evaluate the amount of excess skin that is present, gently push down the eyelid from the eyebrow. This will show the areas with loose skin and where to provide treatment. Multiple rows of treatment will be required for heavy eyelid folds. Remind patients that there will be a substantial amount of edema when treating the eyes and that it is normal. This video demonstrates treatment of the eyelids. Notice how the treatment provider is pushing gently on the brow to see the area of loose skin, is staying at least 2 mm from the lash line, and is avoiding treatment of the inner eye area. Additionally, the treatment provider uses their free hand to provide stability to the hand holding the device. When treating crow's feet, it is recommended that the flattening technique be used. Treatment for crow's feet will require from 1 to 3 rows per line or wrinkle, depending on the severity. This video demonstrates treatment of crow's feet. Notice how the treatment provider is placing points on both sides of the line, and placing multiple lines based on the severity of the wrinkle or fold. Additionally, the provider pushes the skin together on both sides of the line to better visualize the line, and to guide them on where to place the points. Notice that the treatment provider is avoiding treatment of the inner eye area and is staying at least 2 mm from the lash line. The nasolabial folds and lines around the mouth can be challenging to treat because of the depth and the volume. Typically, plasma treatment cannot completely remove these lines, however, they can improve and minimize the appearance. When treating the nasolabial folds and lines around the mouth, it is recommended that the flattening technique be used. The treatment reduces the appearance of the perioral lines by tightening the skin between the lines as well as collagen regeneration that occurs weeks later. An important factor to consider when treating the nasolabial fold is the severity of the fold. For fine lines, 1 to 2 rows of points on each side of the line should be sufficient. For moderate wrinkles, 2 to 3 rows of points on each side of the wrinkle is recommended. And for deep folds, up to 5 rows on each side of the fold is recommended. This video demonstrates treatment of nasolabial folds. The same technique is used to treat other lines around the mouth. Notice that the treatment provider is using multiple rows to treat the nasolabial fold. Many patients who have loose skin on the sides of the face and the neck may not want to undergo a surgical procedure. A plasma treatment may provide the improvement the patient desires with fewer risks and side effects compared to a surgical procedure. Additionally, a plasma treatment is a quick and easy procedure and costs significantly less than surgery. Although many patients will see a change after their first treatment, it is important to manage expectations. These improvements may only be minor and may require additional treatments to achieve the desired result. The skin tightening effects of plasma are cumulative, therefore, providing multiple treatments will lead to better results. When treating loose skin on the sides of the face or on the neck, it is recommended that the dice point technique be used. It is important to stick to the dice point pattern and leave sufficient space between each point so that the skin can tighten to a central point. This video demonstrates treatment of the sides of the face. The same technique is used to treat loose skin on the neck. Notice how the treatment provider is leaving sufficient space between each point so that the skin can tighten to a central point.